Hello, we are here today with Kelly Hillerman, our alumni and graduate of Masters of Public Health program. Thank you for doing this interview. So here at A.D. Still University College of Graduate Health Studies program and Public Health department, we have three online programs. We have Masters of Public Health, Masters of Public Health and Dental Emphasis, and Dental Public Health Residence programs. My name is Jana Gold, and I'm a chair and professor of the Public Health Department. And today I'm so pleased to talk with Kelly about her experience in our program. So please, can you first introduce yourself and tell us your current role and your background?
Sure. My name is Kelly Hillerman. As she said, I currently work in public health as an emergency preparedness and response planner, an epidemiology specialist, and also as a public health nurse. In rural health, we wear a lot of hats. Prior to this role, I managed a school health services contract for 5 schools, and I also worked in an acute care setting in a rural hospital. My educational background is in mathematics and nursing.
Excellent, very interesting. So what inspired you to choose our online program?
I have always had an interest in returning to school, and I enjoy learning and working with people. So when a friend told me about ATSU's College of Graduate Health Studies online, the MPH course, I contacted ATSU almost immediately for more information. It seemed like a good fit for me, being in an online format, so I could still work full-time. And I also knew that ATSU's program was ranked among the top programs in the nation.
Very nice. So was there any specific concentration or feature of the program that really attracted you with us?
For me, I liked that the entire program is online. So it was able to accommodate a busy work and life schedule, and also that the program was accredited by CEPH.
Very good, very good. So when you enrolled, what were your goals, like professionally or personally, and what you were hoping to gain from the experience?
Professionally, I was seeking further development of leadership skills so I could better serve my community, basically to give them the best me, so I could advocate for the community's health and just have a better understanding of public health issues. The program also incorporated the development of skills in areas that coincided well with my job roles.
Very nice, very nice. So how would you describe your overall experience as a student in the program?
Overall, I would describe my experience as an MPH student as very engaged, very engaging. The curriculum created a lot of opportunities for interactions with other students and faculty. It was also challenging as it pushed your thought processes to have to navigate simulated real-world issues.
Very nice. And how did the online format support or challenge you personally or professionally?
Yes, the online format worked great for me because it enabled me to continue working full-time. I could do coursework around my schedule. It offered flexibility to balance the coursework with personal and professional responsibilities. And as long as I planned ahead, I could make it work.
Excellent. So did any specific course or project stand out as especially influential to you?
It did. For me, the applied practicum experience stood out as especially influential because I was able to apply the knowledge I gained throughout the coursework with the skills and experience of my profession in order to develop a strong to end product. So in my project, I was developing orientation and training materials for a local public health agency. And as I was creating it, I could see how taking a little deeper dive into the purposeful creation of the content could make a difference in whether the finished product simply became like decent training material or truly effective and impactful training material that would actually strengthen the public health infrastructure of the community.
That's excellent. Thank you so much for that. So how will this degree really influence your career in the long term? Can you just share some examples?
So the MPH experience, I would say overall, it advanced my understanding of several core public health areas: health policy, epidemiology, social behavioral health, which will help me use evidence-based decision-making and have a greater ability to analyze public health trends. The experience has also sharpened my research skills considerably and strengthened my leadership and communication skills, which are vital for program development and implementation, as well as in effectively engaging communities and stakeholders. So a concrete example, I'm currently assisting with a community health assessment and improvement plan and associated strategic planning for an agency, which involves use of all of those skills, especially being able to effectively engage communities and stakeholders.
Excellent. So do you feel that this degree has elevated your credibility and effectiveness in your field?
Yes, I think it's important to note that educational degrees can elevate both credibility and effectiveness in public health roles, but it certainly does not guarantee it, because how the degree is obtained and how it is used really depends on how much the student puts into it. However, the degree shows that a certain level of training and competence has been met and is recognized among professional health fields and colleagues that I work with. And the curriculum at ATSU really provided students with the tools needed to be able to be effective and successful, to be able to analyze issues, to design solutions, to think critically, evaluate outcomes, and truly enhance overall practice in real-world situations.
This is so great. Thank you so much, Kelly, for your time.
You're welcome. Thanks for having me.